Hello viewers, we're going to talk about cataracts, which is really one of the commonest causes of surgery in the eye. In fact, 80% of surgeries done in most hospitals are cataracts. A cataract is basically the clouding of the normal lens of the eye. So I would just like to explain what the eye is about. We have an eye here, we have a clear cornea, we have the iris, which is the brown sector, and behind we have the lens. Light passes through, hits the retina, and that is how we see. Anything that causes a clouding of this lens will obstruct vision, and basically that is what we call a cataract. Cataracts can be caused by different things. We could actually be born with cataracts, which are called congenital cataracts. We could have cataracts. Most cataracts are due to aging. So as we get older and we need reading glasses, that is the start of a change in the lens, in the consistency of the lens. And we could also have cataracts due to trauma, injuries as children. It could be a blow to the eye, a penetrating injury of the eye. And then we have metabolic causes. So people who have diabetes could develop cataracts. And then we have other diseases which secondarily could have cataracts. So we call those secondary cataracts. And those would be like uveitis, inflammation of the eyes, which could lead to cataracts. But in all forms of cataracts, they are all treated by surgery. Now that we have a lot of lasers, people think you can just go and use a laser and the cataract disappears. It doesn't happen. Everyone has to go for some form of surgery. It could be laser assisted, in which case the surgery is done with a laser used to remove the anterior part of the capsule of the lens, because I will tell you what, this is a mature cataract. A patient in this case will not see at all. And very many times people come into the clinic and say, "Doctor, I have been told that my cataract is not mature enough to have surgery." If you have a totally mature cataract and it looks like this, you'll probably not be able to see. So the stage at which we decide to do the surgery for cataracts depends on the patient's occupation and the patient's visual needs. So a farmer might not need to have surgery as early as an air pilot. An air pilot might need to have a cataract when his vision is 20/30, whereas a farmer can wait until his vision is about 2400 or has navigational vision. So basically, timing for operation is due to the individual. If you're a driver, for example, you need to have cataract extraction early. If you're doing work that needs a lot of reading, you will need to have your cataract extraction done early. Surgery will need to be done earlier because cataracts tend to affect the reading vision a lot more than the distant vision. And what we say about surgery is that basically, surgery for children needs to be done under anesthesia. And when it is done under anesthesia, it means the patient has to be put to sleep. Also, patients who have Parkinsonism, which is a disease in which they have a kind of shake, will need anesthesia to keep the patient quiet. If a patient has psychiatric problems also, he might not be able to stay to get surgery done under local anesthesia. So otherwise, we'll have local anesthesia done, which means eye drops are put in the eyes, and a few injections are given around the area of the eye, usually one to block the facial nerve, and another retrobulbar or peribulbar around the area of the eye. The patient lies down and surgery is done. Most surgery now done is a phaco technique. And the phaco technique requires experience, expensive technology, and expensive machinery. Here at Prime Opticals, we actually do the phaco technique. That is the preferred technique all over the world for the last 20 years. However, it depends on what stage the patient comes. The patient who comes with a very hard, hyper-mature cataract, we might find it might not be very simple to do that technique. But otherwise, for people who come in early, 20/50, 20/60 vision, 20/80 vision, phaco is the preferred technique. Some people do phaco using the laser to make an opening in the lens, because I'll tell you what is done. We basically have a lens. We make an opening in the lens. We use the machine to suck out the matter in the lens. We leave a clear bag and we put in an intraocular lens. So that's what basically is surgery for. But surgery for phaco uses a very small opening. And because it's a very small opening, the lens which can put inside is usually a foldable lens. And this foldable lens is as near as normal as possible to the normal human lens. Rehabilitation is quick for the patient, and within 4 weeks, we can prescribe glasses. Whereas for the other method, we make an older opening. We have to we make the opening in the anterior capsule of the lens, but we have to take out the lens we have to take out the lens sort of like totally. So we need to make a bigger opening, and we put in an IOL. So in all forms of surgery, in some forms of surgery, we need to put stitches. In phaco, we don't usually put stitches, but here in Nigeria, we usually put in a safety stitch because our weather is very dusty. The risk of infection, because we are doing the surgeries from the side, which means that the opening is sort of left to the atmosphere, we put a stitch, which can be removed later. However, for some of the other surgeries, which is a small incision cataract extraction, if the patient is older or a child, we will put a stitch or two. Otherwise, cataract extraction is quite simple. Success rates are between 90 and 95%. We might have an infection, unfortunately, that might happen occasionally, but very many times also there might be some issues behind the eye which we were not aware of. If the patient had glaucoma or the patient had a scar from a previous intrauterine infection or problem in life, then it might not turn out as successful as we wish. Otherwise, hospital stay in some cases are day cases, other cases might stay a day, 2 days, usually not much longer than that. And recovery is usually quick. We usually advise the patients after surgery not to involve themselves in strenuous activities, contact sports, vigorous sex, sweeping, or things which would make the patient be bending over very much. Judo and things like that should be avoided for 6 weeks. Otherwise, recovery is usually great. Some people talk about having a cataract after a cataract. We talk about a posterior capsule. So like I said, we actually do remove the anterior capsule. We wash out the lens matter, suck it out with phaco, and we actually do leave the back of the capsule there, and that is where we put the intraocular lens. Sometimes the area which we leave can become thickened, and we need to do what we call a YAG procedure. It's a YAG laser procedure, which is done. We have that in Prime Opticals. It might be anything within 3 months to 5 years after you have the surgery. The laser procedure is done. It's something where you come in, and it's probably a 5-minute procedure after drops are put in your eyes. So cataract extraction or cataract surgery, when there's no other accompanying disease, usually is successful. We do not like patients to wait for their cataracts to get very hypermature because it could cause secondary glaucoma. Patients sometimes wait and they tell you they are very scared about having surgery. So like you say, when a fruit stays too long on the tree and it gets rotten, it doesn't taste nice in the mouth. And so it is with a cataract. If the cataract is too hard and it becomes over mature, it makes it very difficult for the surgeon to get it out. So if you do have a cataract, do come in. It's a simple procedure. We have qualified people here, and surgery is always done by the head of the team, who is the ophthalmologist. Thank you for listening.